Hello again, I'm Eric Olson, KSMQ Public Television, with a special On Cue looking at COVID-19 in our area. And I'm pleased to be joined right now by Graham Briggs. Graham is Director of Olmsted County Public Health, joining us from Rochester. Hi, Graham.
Hello, Eric. Thanks for having me.
You bet. We have the numbers out this week of the case load, if you will, in our viewing area. And Olmsted County, as of the latest statistics that I'm able to find, 239 cases, 6 deaths so far. We have Mower County at 28 cases, Freeborn 33. You could see the other numbers there. Winona County, 66 cases, and 13 people passed away from COVID-19 related so far. Graham, how do you assess, if you do, how Olmsted County is doing? The trend lines, are the caseloads still coming in fast and furious?
Yeah, I think that's something we want to do at local health departments, and I'm sure this is happening all over the country. Uh, we really want to go beyond just saying that we have 239 cases. We've got a team that's really looking at what do our cases look like in relation to other counties and the nation really overall. And so that helps us answer that question as to how do we assess our situation and what does it really mean. So we can see in Olmsted County that we've got a lot of cases. We've got a high what we call incidence rate, or a lot of cases per capita in the community. But we can also see things like our hospitalization rate is lower. Our average age of cases is a little bit lower. Our comorbidities are a little bit lower. And so there's a number of clues there that say that while our case number is high, maybe we're actually catching more of the mildly ill cases because of this great partnership that we've got with Mayo in Southeast Minnesota, working with both Mayo and Olmsted Medical Center. The drive-through setups that we've got have been very successful. We've got a lot of testing done through those sites, and what I think the data is showing us about our cases is that we've got a little bit more capacity to test here and find some of those younger, more mild
Oh,
people that aren't ending up in the hospital where they get tested. What that means to us as well is that the more cases you find, the more contact investigations and contact tracing you're able to do. So I think that's a big part of this whole thing too, is as the governor is talking about, building a contact tracing army, and we're hearing about that around the country. What that really is about is finding every case that we can and identify those people that may be incubating virus and isolate them before they start shedding virus and become infectious. So if we're already doing that a little bit better than the norm around the country right now, I think we're moving down that path. And so while there's work ahead, I think what the data shows us in Olmsted County is that we're actually not doing too bad at identifying cases and following up with them.
and your personal history kind of really benefits, if you want to use that term, uh, Olmsted County, having come from Arizona, where you had a health situation there, where you had an outbreak, not nearly anything like COVID-19, but tools that you picked up and knew about when you came here.
Yeah, I will say for the audience, I am originally from Minnesota and went to high school in St. Paul. So I'm a Vikings and Twins fan, but I did live in Arizona for about 20 years. And while I was there, my background is as an infectious disease epidemiologist, coincidentally here. So um, before I moved into this role back in Minnesota, I was overseeing infectious disease control programs and things like that. And so we had outbreaks from tuberculosis to salmonella to um, leprosy to measles. And I think that's one that we can maybe relate a little bit to COVID 19 is measles. And we had a number of different outbreaks when I was running a program down there. So a lot of the tools that you develop during these highly infectious, easily spread respiratory viruses hold similar to to COVID-19. So some of the stuff that we're actually doing right now, when we're talking about contact tracing, that's almost identical to what you would do for measles. You know, call people, let them know that they've been exposed, try to determine if they're at risk. We've got a few different things there, like a vaccine, for example, totally changes the ball game with measles. That's why we don't see it as widespread. But um, a lot of those skills that you develop working on that sort of thing really translate into this. We Another example is with flu. You know, you look for respiratory illness in the community for influenza every year, and we can use some of those same skills. I think looking for COVID-19 in the community as well.
And you're ahead of the curve a little bit, as you indicated. You and your public health team are, so when somebody has COVID, you go in and look at maybe who they have been in contact with and try to get to those folks. Is that the idea?
Right. We actually we're starting to go one step further than that now too. So we work closely with the Minnesota Department of Health, and between the health departments, when a case is identified, we're following up with all those individuals that we see as at risk. Minnesota's been able to this point to follow up on every case that we've identified, which is turning into a large task. But then additionally, here level, we're working with MDH to go a little bit further. And as we identify clusters of cases or high risk populations or a combination of both, be able to start getting into those communities at risk. And that's where a relationship that local health departments have with the community really makes a difference. If we're seeing a specific neighborhood or um, 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 specific group of people that congregate to play poker on the weekends, or
Hmm.
those sorts of things. We can start identifying those clusters and not just do that specific contact tracing. We can go to that whole group. Okay, we need to do some education, or we want to really get into preventing people from getting exposed in the first place. Is ideally where you'd like to go.
What about opening up the state, as we keep hearing about, and the governor talking about yeah, a slow, methodical reopening? I was on a golf course this weekend in Minnesota, which was a new thing. What's your take on that?
Well, I think it's an interesting concept that we're taking here in Minnesota. I know there's a lot of attention to places starting to open up, and um, what we're doing here in Minnesota is kind of a hybrid, and it's a little bit unique, I think, compared to some other places. So I I have to applaud the governor on this, taking both a science-based approach and looking at what our numbers say and looking at what we're seeing in the community, but then applying decision making on top of that, so that we don't just see we're going to stay shut down forever, which that's not realistic, obviously, but at the same time, just opening everything back up potentially puts people at risk, and with this disease, potentially puts people's lives at risk. And so being able to take an approach where we could say, "Oh, we can open up some things, but let's do this with the understanding that uh, we can really limit the chances of transmission at the workplace. And we can not only turn the dial up a little bit, we can turn it back down too." And so I think it's an interesting approach to say that, we can open this up a little bit. Let's see how it goes. Maybe 10 or 20% of people at a workplace start going back little by little, and if we figure out that we can do that without huge increases in transmission and morbidity associated with it, we can crank the dial up another notch or two. So it's going to be interesting. Unfortunately, I think there's not a playbook with this around the country. So you could see places, where they're opening up nail salons, or they're, opening up beaches, and all kinds of things like that. And um, I think we're starting to see around the country, different states are taking different approaches, and I think we're going to have to learn, because there isn't a playbook on what sort of approaches work and what ones don't. Obviously, we hope everything works, but I think we're going to have to wait and see on some of these approaches how they work out.
Graham Briggs is our guest, director of Olmsted County Public Health. Finally, sir, I've been asking just anecdotally, I've been to Rochester twice in the last week, but my home is Austin. How is it with people wearing face masks out in public? Are you seeing a lot? Is it 50-50, or aren't you able to really gauge? It's just interesting to me. As you say, we're learning. This is sort of a, we're learn as we go about this, and just curious.
Yeah, I wrote an editorial the other day about what I'm observing out in the community, day to day, and how life has changed just over 6 weeks or a couple of months. And so I could say in our emergency operations center now, we try to stay out of congregate settings, but for those of us that have to go in, sometimes we socially distance. We all wear masks in there, and then, on those days that I have to stop by the grocery store on the way home or something like that, or when I have been out, it's very seldom now. I don't see a lot of people out there, but I do have to grocery shop. That's the one place that I'm going with some routine, and it's been remarkable to see the transition as I would say most people, at least in Rochester, at the grocery stores are wearing masks now. It almost is becoming the norm where you wonder at some point the people not wearing masks are going to be looked at a little bit differently rather than the people wearing masks. And so it's encouraging to see that the people are doing what they can to help out.
That's wonderful. Well, stay safe, sir. And thank you very much for your service during this very unusual part of our health history.
Well, thanks for having me, Eric. You stay safe too.
All right, sir. Graham Briggs, Director of Olmsted County Public Health. That'll do it for us right now. For now, I'm Eric Olson, KSMQ Public Television.